From a Chinese medical perspective, rashes are the body's way of venting to the outside any heat or other pathogenic factor that it doesn't want on the inside. Heat, for example, can do serious damage to your child's internal organs. His or her body knows this, so it moves it out to the exits, in this case, the skin. Rashes can be caused by a lot of different things, and they can appear in a lot of different ways, from sunburn-like to blistering to hives. Even though it's sometimes difficult, the first thing to do is to consider what may have caused your child's rash. If your child's rash is caused by something internal, like a food allergy or a virus or a medicine that your child is taking, the rash is generally going to appear over a wider area and more symmetrically than if the rash is being caused by something external, such as contact with poison ivy or a detergent that you may have used. In these cases, the rash is going to be more localized to the area of greatest exposure. So what to do? Well, after you eliminate the possible rash causers, there are a few home remedies you can try to ease the itching. If the rash may have been caused by a medication, is weeping or oozing pus, or is very swollen, or comes with other symptoms of allergic reaction such as difficult breathing, you're going to want to get medical help right away. Also get medical help right away if the rash comes on with fever, joint pain, or neck stiffness. If the rash persists without any other symptoms, but has not gone away after a week of care, you'll also want to seek the advice of a medical practitioner. Otherwise, your main job here is to heal the discomfort and make sure your child doesn't scratch at it too much, and try, if possible, to prevent it from happening again. Provided that the rash is not covering these areas, you can place magnets or massage the area directly between the outer crease of the elbow when the elbow is bent and the thumb faces out and the funny bone, an area very close to this on the inner elbow crease on the thumb side, in the depression next to the tendon of your child's biceps muscle, a point between the second and third toes on the top of the foot, just a hair's breadth below where the two toes join, and a point between the big toe and the second toe, again just a hair's breadth to 1/4 of an inch beneath where the two toes join. Moving up your child's leg, place your palm against the base of their kneecap and spreading your fingers out evenly. Where your thumb hits the inside of your child's thigh, you'll want to apply firm but gentle pressure for 1 to 3 minutes. This point here is a great point for cooling and clearing unwanted heat out of the blood. Now, turn your child onto their belly and massage at the crease of the knee, right in the center. This is another great point for clearing heat and venting a rash. You can massage any or all of these points for 1 to 5 minutes and/or place a magnet on them instead or when you're done. One thing you might try is a baking soda bath for your child. Place 1/2 cup of baking soda in a lukewarm to cool bath. Try not to use hot water since rashes are often a sign that heat is already existing in your child's body. You can also make a paste of baking soda and a little water and place it directly on the rash, provided that the skin doesn't have a lot of open wounds or blistering. You can also try a compress of half milk, half water. Warm the milk first, then apply. Something in milk protein is very anti-inflammatory, which means it can help the swelling go down. If the area of the rash is not open and raw, you can also use witch hazel, a clear plant liquid you can buy over the counter. You can also use witch hazel to soothe a bum irritated by a diaper rash or a wet swimsuit. Witch hazel is really excellent at soothing and calming hot and inflamed skin. Just dab it on gently with a cotton ball. Unless you are using a compress on the site of the rash, or the rash becomes open or blistered, you'll want to keep it uncovered so that it can dry out or breathe. The exception is if your child cannot stop itching or scratching at the rash, which can make it inflamed or infected. In that case, you may want to take a clean piece of gauze and place it over the area loosely. Optimally, air will be able to circulate underneath. You'll also want to wash your child's hands more frequently than usual to prevent possible spreading of rash or infection.